A very good afternoon to everyone. I am Nishita from Clarnet. Welcome all the doctors to today's webinar. AIIMS Patna and Merit India presents Sample Size Made Easy Cohort Study. Clarnet is proud to be associated as a digital partner. Now, I am going to play a short Clarnet's video. I would like to request all of you, please have a look. Clarnet is India's largest live digital CME and doctors-generated medical content platform. Now, I would like to hand over the session to Dr. Venkatesh Karthikeyan, sir. Sir, over to you.
Thank you. Good afternoon, everyone. This is Dr. Venkatesh Karthikeyan, second year PG resident in the Department of Community and Family Medicine, AIIMS Patna. I hope our RMFC team don't need any introduction as most of the delegates here are now a part of a learning family. For new people, we, Team Research Methodology Foundation course, work under the umbrella of Community and Family Medicine Department, AIIMS Patna. RMFC team always love innovations and spreading knowledge. Everyone knows the importance of data science. As you all know, we have successfully conducted many basic and advanced data analysis workshops. This webinar is a continuation of that. Now, I would like to introduce our key resource person, Dr. Pragya Ma'am, who is multitasking as the Registrar of AIIMS Patna, Additional Professor at the Department of Community and Family Medicine, Nodal in charge of RMFC, ICTC, yellow fever vaccination, and many more, along with the vibrant faculty of our department, Dr. Samshad Ahmed Sir, Assistant Professor at the Department of Community and Family Medicine, AIIMS Patna. We have already successfully conducted 2 webinars related to sample size calculation, and now I take immense pleasure in welcoming all the 1,200 plus registered participants to this webinar about sample size calculation for cohort studies. Now I request Dr. Pragya Ma'am to take over the session. Over to you, ma'am.
Thank you, Venkatesh. And a very good afternoon to all the participants. And in this session, we'll learn about the sample size calculation in cohort study. I hope the last 2 sessions of cross-sectional study and the case control study, you must have seen the video. Try to practice some of the exercises, because the more you practice, the more you will understand regarding what input value you have to put in the statulator, or you have to calculate on your own. So with that, I'll start sharing my screen. And today's session is about the cohort study. So a little bit of brief introduction regarding what a cohort study is. So all of us know, but still I will try to brush up those concepts, that in cohort study, we start with the exposure. That's the essential or the heart of the cohort study, which makes it different from the other study design. That in cohort study, we start with exposure. So we start with a set of individuals, and we can then ascertain their exposure regarding the presence or absence of that exposure. So initially, there is no outcome. And then we follow that particular set of people for a certain period of time, and then we compare the incidence of that outcome. So we compare the incidence in the exposed group, and then we see the incidence in the non-exposed group, and then we calculate the absolute risk, relative risk difference, and there are a lot of risk what we calculate in case of a cohort study. So in this case, one essential feature is that there should not be any outcome of interest in the beginning of observation. And then you again do that outcome ascertainment at the end of your study period. So the outcome needs to be ascertained at minimum 2 points of time, at least 2 points of time, because once you do that in the start of the study, and then you do at the end of the study, just to make sure that the individual which you recruited, they were free from the all that outcome which you want to ascertain. So this is the basic of the cohort study. And then again, the cohort can be of many types. The most common type of cohort what we study is the prospective cohort study. There is another type which is also known as the retrospective cohort study. don't get confused this retrospective cohort with the case control study, because that word retrospective, that is attached in the case control also. So many a times our students, the MBBS students, they also get confused how to differentiate between a retrospective cohort and a case control study. We'll see what is the difference. And then there can be a combination of both two, which we call as the ambivalent study, where there is a combination of both these retrospective cohort and a prospective cohort. So let's begin the first type of cohort, that is the prospective cohort study. So in prospective cohort study, you start with an individual which are free from the outcome. And this is a classical cohort study which has been done in the UK, which is known as the Nurses Health Study. They started with 1,17,000 nurses, which were the registered nurses. And then they were free from the cardiovascular disease or myocardial infarction. And then they have divided those nurses on the basis of the BMI. So they made two groups, a lean person with less than 18.5% of BMI, and the other group was the obese person, where the other BMI, it was more than 18.5. And then they compare the incidence of the myocardial infarction and the cardiovascular disease. So they have started with the exposure. They have categorized all the study population on the basis of exposure. Then they followed them up for a certain period of time, and then they ascertain the outcome, where they compare the incidence of the disease. So at the baseline, they collected all the data and they have done the categorization on the basis of exposure status. Definitely there will be a follow-up period, and then at the end, it is the outcome ascertainment, and there is a determination of the outcome status. So this is a prospective cohort study, and the classical example which we are giving, that is the example of the Nurses Health Study. In case of a prospective cohort study, we calculate incident rate. Now, incident rate, that is different from relative risk, because there is a concept of person time here. So in this example, you can see we have started, this is a hypothetical example, and we have quoted the reference also. So we have started with 12 individual, and then these 12 individual, we have followed them up for a 15-year period. So this study was started in 1981, and you can see from 1981, all that year, this x-axis is showing the time. So they have been followed up till 1995. The cross is depicting the disease. So out of these 12, 3 people, they have developed the disease. And this is the person risk. This is the time at risk. That means it has been followed up till 8.3 years. So the person year is 8.3. The B was followed up from the start till end. So it was 14 year. Again, C was also 14 year. D was followed up till 10.2 years. And similarly, you can see F, this was lost to follow up. This F was the development of an outcome. So the person year was 3, and then 12, 7. So these lines where you cannot see anything, they could not reach to the end, and there was a drop in between. That is known as the loss to follow up. There can be many reasons for the loss to follow up. We are not discussing those reasons, but you have the person year at the end of all the study period. And then if you calculate all these, so the total time at risk, it is 107.7. So if you see this 107.7, this is the total time of risk. And if you divide this, so incident rate we calculate, in the numerator we have the number of outcome. So the number of outcome is 3. And in denominator, you have the person year. So the person year in this case is total 107.7. So in this case, the person year is 0.028. And since this is fractional, so you make it as a whole number, because 0.028 doesn't make any sense. That's why you say that the incident rate is 28 per 1,000 person year. So this is the incident rate, calculation of an incident rate. Now, if you have to calculate the absolute rate, what will you say? So the absolute rate is the total number of events. So event happened was 3. And then out of the 3, out of 12, there was 3 people. So it will be 3 divided by 12 into 100. That will be the calculation of absolute risk. So this is how in a cohort study, we calculate the incident rate and we calculate the absolute rate. Now there is a question, is there any time duration of conducting the cohort study? So the time duration, it depends. In case it depends like how much time it takes from the exposure till the development of the outcome. So it depends on the natural history of the disease also. So that's why for diseases which takes a long time to develop, you may do a retrospective cohort study where there is already that event has occurred and you have that exposure also. Because cohort study, you must have read and we know it, that it is very difficult to conduct. The classical example which you see, that is the Framingham heart study, that is still going on. So it is approximately 70 years that still they are ascertaining the outcome, because they started with the subjects and that population is still there in that Framingham area. So there is no fixed time for cohort study. In a clinical setting, they may, like in anesthesia in ICU, you can do a prospective observational study without a comparison group. We will study this in detail a little bit ahead, I mean, after 3 or 4 or 5 minutes, because in cohort, it is not essential that you should have a comparison group. There can be a cohort when there is a no comparison group. I'll give you an example in case of ICU, medical ICU. If you want, because we have seen many proposals where like at the time of admission, what was the albumin level, or maybe at the level, the GCS score. If you want to see the GCS score and the mortality in ICU, in medical ICU or in surgical ICU, any ICU, maybe in emergency ICU, then it can also be a prospective cohort study, because you started with the risk factor of GCS, and then you can again categorize those GCS in the basis of good GCS and poor GCS, and you can compare the outcome. You can see the outcome, and the outcome maybe you can define it as a mortality, or outcome you can define as a discharge. So it depends what outcome you decide. So there is no fixed time of the this cohort study. In case of lifestyle diseases or the community-based cohort, it may take years, like 5 years, 10 years. In case of a cancer patients, when we study the mortality or we study the survival, it may take 5, 10, 15 years. But in case of short event, like, you know, ICU studies, or maybe in operation theater also, a lot of people do in anesthesia, like pain-free period. So they give, they do one intervention, and then they see after how many time the person was free of pain, depending on the rescue analgesia required and depending on the VAS score. So that is also a type of the prospective observational study, when they are having the outcome ascertainment at least twice, and they are observing the person over a period of time. So I hope your question, this concept got cleared. And in case of other questions, you can text us and you can write. So Shivani, you wrote to us. So I think you are clear now that there is no time period, fixed time period. It can start, it can have a 1 day, a 2 day period, or it can range from 70 years. So depending on the natural history of the event which you want to study. So now continuing the talk again. So this was like incident. I talked how to calculate the incident rate. In this case, it was 107 points this person year. So the incident rate was the 28 per 1,000 year. So now I hope I have made myself clear. Then what is the difference between an incident rate and an absolute rate, and also how it is different from the relative risk. So this was the same example of the nurses' health study. And in this case, you can see that the investigator, he has classified on the basis of exposure. So he made 5 categories of the exposure status. So this less than 21, he classified as lean. And the next, all these 4 categories, depending on that BMI status, he has observed the rate ratio. So this rate ratio is the relative risk. And this is the MI. MI is the myocardial infarction rate per 1,000 person year. So you can see as this BMI is increasing, you can see the rate of MI, the incident rate, because incident rate we defined as a person year. So this incident rate is increasing. So it is highest in case of a more than 29 BMI. And you can see the rate ratio also. So the reference point for all these rate ratio is the lean one, less than 21. So this is the reference. And then this 1.3, 1.6, 2, and 3.7. This all rate ratio is with respect to the lean one, less than 21, which is the reference point. So we calculate the incident rate and we calculate the rate ratio in case of a cohort study. Now coming to the retrospective cohort study, because we have learned that there are three types of cohort study. There is a prospective cohort study, which we have just seen, that is the nurses health study. Then the second type is a retrospective cohort study. And this is usually done, you can do it in any other research question also, but classically it originated from an occupational exposure. So like there is an example here, again, we have taken it from this reference. So there is an employee of the tire manufacturer and we have got the record of those employee. So we have divided those employee into the two categories. There were employee who were directly working in the tire making, and then the other category was the clerical staff. So this the other group was the clerical staff, and this case you can see this clerical staff was acting as a control group in this case because they did not have the factor of interest. And then the incidence of mortality was compared in between these two groups. So you can see here that the start of study, when the investigator has planned to start the study, already the outcome has happened. Because this line you can see that the outcome has already happened. But we will not call it as a case control study. Why? Because we have started with the exposure here. So the classical difference between a case control and a cohort study is that you start with the exposure and then you ascertain the outcome. So you have started with the exposure here. So this was the exposure, was the exposure to the tire making industry. So employee, one group we took the tire makers and the other group we took the clerical staff. And then we have seen the death rate incident, and this was the outcome. So the basic concept of a cohort, that we start with the exposure and we ascertain the outcome, it has retained this outcome. So that's why it is a retrospective cohort study. And although we know that already the outcome has occurred, but since it is we have got the record, so this we can do it, this study, and it takes much less time because you can bypass that time, because we know that in case of development of mortality or development of some lifestyle diseases, it takes a lot of time to develop. But this retrospective cohort, it takes less time, and cost is also very less. But again, it is prone to few type of biases. And we'll see what are those biases. The disadvantage of this retrospective cohort is that the exposure status which the investigator planned, that research question must have come to his mind, but he was not, that exposure has already happened and he was not planning to collect it since beginning. So the exposure status was not, many times it was not clear. And even if it is clear, there may be other factors which are responsible for that mortality. Maybe the workers who are working in the tire industry, they may be more smokers because of the stress. They were smoking and they were alcoholic, and the people who were working as a desk job like a clerical staff, they were suffering, they were having less stress, so they were not taking maybe alcohol and smoking. And we know that alcohol and smoking, they are again a risk factor for mortality. So the confounding factors of this mortality would be smoking and alcohol, because they are associated with the exposure status and they are associated with the disease outcome also. And that's how we define the confounding factor, that a confounding factor is an independent risk factor for that outcome, which in this case is smoking and alcohol, which is an independent risk factor for the mortality. And again, it is associated with that rubber, the tire industry worker. So there may be potential confounders of that mortality, of that outcome. So these are some of the biases which may happen in case of a retrospective cohort study. But in spite of all those biases, it is, we can say that this retrospective cohort, it takes much less time and it is a very cheap study also. That resource, it is not that resource intensive, because prospective study as a part of thesis or maybe that long time, I'm talking now of a community-based prospective study. That is a difficult to carry out. But like if you wish to carry out in OPD, if you select some research topics which are easy to do, then you can definitely carry out a prospective observational study or a cohort study in a hospital setting also with a set of patients, especially in a setting like if you have a specialist clinic, like you in medicine, you have a diabetic clinic, you have a COPD clinic, you have a geriatric clinic, and you have like a palliative care clinic. You may have a special situation like PSC clinic. So maybe all those clinics where you get the fixed individual over the period of time, then you may plan to carry out a prospective cohort study in your setting also. Then talking about the comparison group, if we talk about the comparison group, in general, we define there are 3 comparison groups. But along with this statement, I'm also making a very strong statement that a prospective cohort study doesn't always need a comparison group, because there you will often find yourself a lot of time we indulge into this discussion that a cohort study, how can it be without a comparison group? But no, a cohort study can be without a comparison group. You cannot calculate the relative risk, but definitely you can calculate the absolute risk. So we will see what is the basic difference between a cohort study and a case series, because that is, people get confused. Many people, they label case series as cohort and cohort as case series, vice versa. And you will see in the PubMed, there is no classification as such case series. So if you are classifying cohort study as a case series, then definitely in meta-analysis, in spite of having a good power and good analytical result, you may not be able to put those studies or have those studies in your analysis. So that's why you should be classifying well between the case series and a cohort study. So we will come to that section of discussion. Just wait for a few minutes. Right now we are discussing that there can be 3 types of control group, comparison group in case of a cohort study. So the first type of comparison is an internal comparison group. And the example which we have seen, that is the nurses health study. When they have started taking all the people, and from that, on the basis of BMI, they have classified the lean and they have categorized according to the 5 levels of exposure. So that was a gradient. So you can have a gradient also in cohort, or you can have on the basis of less or more. So you may start with exposure where everyone is exposed, but still you can make categories like less exposed and more exposed. So again, that will be a comparison group. The second is the comparison cohort, where in case of a occupational exposure, you select person who is free from that occupation. And then the third type is the general population. So this internal comparison, like we have talked regarding this nurses health study. So the best comparison group in any of the cohort will be exactly the same cohort, but not exposed. But not exposed and exactly the same, this is practically not possible. So in that case, the least exposed you take as a reference. So in this case, you have seen that the less than 21, the investigator took it as a reference, and then he calculated the relative risk of all other categories of the BMI. And what he calculated? He calculated the MI, incidence rate of MI, and he calculated the relative risk. So this is the internal comparison group. Now the second comes is the external comparison group. So yes, Nidhi, we are coming to the second category. second category is the external comparison group. So generally it is done in the occupational exposure. Like in this case, you can see that the investigator took the exposure as a disulfide. He took the RAN factory workers as a exposure, and then he was about to see, he was ascertaining the exposure as the incidence of heart disease. So he took another external exposure, and that he took a person who were working in the paper mill industry or the paper mill worker, because they were not having any disulfide exposure. So that was the external comparison group. So in the first case, nurses health study, what we did, from that occupation only we have classified based on certain cutoff. And in this case, the investigator took entirely different comparison group. Like we, that comparison group we always say in case of a case control, like a person who is suffering from a disease and control, you can take a healthy control, or you can take any other control which is free from that particular disease. Decided, I mean, you have to be doubly sure that the both diseases should be unrelated to each other. So in this case also, yes, this disulfide exposure, there is no disulfide exposure, and the paper mill worker, the investigator took as a no disulfide exposure, and then he calculated the incidence of heart rate. So this is an example of a external comparison group. Now coming to the third example. So the third example is the general exposure as a general population as a comparison group. So in case if the exposure is very rare, like it is very difficult for you to find a control group and exposure is very rare, then you can take the general population also as a exposure. We will see in the example also that we have calculated, we have taken the background risk of that particular population. Like in a sample also, if you're planning to do some research on a special group like on rubber worker, you can take their mortality and you can take the background mortality also of general population. So this is the general comparison. But again, it is also prone to bias, because in general comparison, in general population also, there are many reasons of mortality. And it is generally known that the people who are working well, they're like rubber worker, they are every day going to the office, they are doing the physical exercise, they will be healthier than the general population. So in that case, we define a effect known as the healthy worker effect. I think you or many of you have heard this term, healthy worker effect. So what is this healthy worker effect? That the people, the occupational group which you are taking it as an exposure, they are healthier than the general population because of their occupation. So there may be some wrong calculation of risk because of these confounding. So this is the example of the comparison group, general population as a comparison group. So we discussed till now regarding the type of cohort study. I'm just revising because few people have joined late. So we have discussed like the types, that is the prospective cohort, then we have done retrospective cohort, then we saw the combination of both, and then we discussed regarding the person year, how that is different from relative risk and absolute risk. And then we read about the comparison group. And then we have come to know that a cohort study can be done even if there is a no comparison group. And that's the difference. So I will give you one example, and you have to identify what is the exposure and what is the outcome. Because if you identify these two things in a research question, it will be very easy for you to calculate the sample size. And because you have to identify also in terms of mean and proportion, what outcome measure you are identifying. So just see this research question, this title of the study. The title of the study is the Prospective Observational Study of Domestic Violence During Pregnancy. So all of you, please type in the chat box, what is the exposure here and what is the outcome?
Ma'am, you're muted, ma'am.
So violence, thank you, Venkatesh. So violence is exposure, yes. And pregnancy, maybe it is not clear from the title, but definitely the pregnancy outcome is whatever outcome. I mean, the author is not very clear in the title what is the outcome, but definitely the outcome would be some outcome regarding baby birth, maybe low birth weight, etc. That we'll come to know when we'll go through the article. So yes, you are right. Now, if I plan to study this, so exposure is the domestic violence and outcome is the pregnancy outcome. Whatever outcome, we are not sure what is the outcome, but exposure is the domestic violence. All of us agree that exposure is the domestic violence. Now, how can we plan this study? If we have to plan this study, we can plan like, we can start with all those all those people in an area. Maybe we can start with the area, all those female who are coming to the gynecology department. So we may classify the women on the basis of presence or absence of domestic violence. So the domestic violence present and the domestic violence. So we are only taking the, maybe you can have this data. So in this case, you are not having any comparison group. So you can have this data of domestic violence, maybe from a National Commission of Women, or maybe from a police FIR, or maybe any other NGO which is working towards this domestic violence. So you may take all those women of domestic violence, then you can follow them up and you can see their pregnancy outcome. So in that case, you have if I define that pregnancy outcome as a low birth weight, then I have this A, which is the low birth weight in case of a domestic violence. And then I have this B, which is the normal birth weight in case of a domestic violence. So this is which type of study? I have only taken this domestic violence and I don't have a comparison group. Means I don't have any other group where there is no domestic violence. So I'm only observing this domestic violence in this pregnancy outcome. And I've started with women who had this, I mean, who are experiencing this domestic violence. And then I will see. So yes, Parul and Sayanti, many people, they are writing the prospective cohort, but there is no comparison group. Will you call it as a cohort if there is no comparison group? So Varun, Sayanti, Parul, many people, Nandita, Pratik, Aradhna. So yes, you are right that it is a cohort study. And here you will calculate the absolute risk. So how you can calculate the absolute risk? So the absolute risk will be A by A plus B. So low birth weight divided by denominator, you will take all those women who suffered from domestic violence. Although there is no comparison group, but still you will call it as a cohort study. Am I making sense to all of you? Are you getting some hang of this cohort study without that comparison group? Okay. So now coming to the second example, now I have added one more group. Okay. So this is I have again taken a group of women who were not having this domestic violence. And then I have decided this C is the person in this C is the low birth weight in case of a women who were not experiencing, and this D is the normal birth weight in case of where there is no history of domestic violence. So now will you call it as a cohort study? Yes, definitely yes. Because this is the classical cohort study which we were studying till now. That yes, you start with the exposure and there you again have a comparison group where that exposure is not there. And then yes, so you are very right in your statement that relative risk can be compared now because you have a group. Now you have a comparison group, so you can calculate the relative risk. Otherwise, in the first case, like if you see this, in this case, you cannot calculate the relative risk. In this case, you can only calculate the absolute risk. But that also, because you are calculating the risk, it will be known as a prospective cohort study or a cohort study. So now coming to this second type of example. So what will be the study design if you collect data like this? So you have taken domestic violence women and you have only given the result of the ladies who had this outcome, which was in the form of a low birth weight. What will be the study design? All of you, please type in the chat box. I'm waiting for your responses. Think for a while. I made few statements in the beginning, like which are the studies which we get confused while interpreting, and that's why, yes, Suashri is very right. Pratik and Anuradha, no. So I think I will go by the answer of Suashri. No, it is the case Tanay. Yes, now you are, it is a case series. Very right. Not case control. It is a case series because you don't have a control group here. You have got only A. That is, if you imagine your 2x2 table, just imagine your 2x2 table like this one. So if you imagine your 2x2 table like this, and if an investigator is only presenting the result, I'm not bothered now with that exposure and outcome. I'm only bothered about how he presented the result. So if the investigator is presenting his result, focusing only on this A part, means the outcome in the exposure group, then it is a case series. It is a case series, okay? And if he again giving this low birth weight as a C, like he has taken only this case control part, case part of this case control. So you can see he's only giving the detail about this A and C, means he is telling low birth weight in ladies who underwent this domestic violence and low birth weight in ladies who did not experience domestic violence. Then also it is a case series, because in both these cases you cannot calculate risk. Neither you calculate absolute risk nor you calculate relative risk. So if the investigator is only presenting the result in the form of A and C, and you don't have the other group here, which this other group or the comparison group is missing here. So you cannot calculate, neither you calculate the absolute risk, nor you calculate the relative risk. So these both type of expression of result, whether that investigator is doing in the form of A or he is doing in the form of A and C, this is known as the case series. Okay. So to summarize once again, if the investigator is only doing a study where he is presenting the result in the form of A and B, there is no comparison group, then this is a cohort study. If the investigator is presenting the result like this, where he is having a typical 2x2 table, then we call it as a cohort study, classical cohort study. And if the investigator is only presenting his result on the basis of this A, I'm sorry, on the basis of this A, it is the case series. And even if he is doing it on the basis of this A and C, it is the case series. So both these A and A plus C, if you take both these two together or A as a separate, this will be an example of a case series. So I hope I am able to convey this point of differentiating point between a case series and a cohort, because we often get confused what to label a study, because case series is also, we do a lot of time case series study, but many times we mistakenly we label it as a cohort study. Now coming to this migraine as a risk factor. So just see this title, migraine is a risk factor for hypertensive disorder in pregnancy. It is a prospective cohort study. So in this case, please all of you type in the chat box, what is the exposure? Although I have written here. So what is the exposure? So migraine. And what is the outcome? So yes, hypertension is the outcome and migraine is the exposure. Yes. So all of you are right in this case. So exposure is the migraine and outcome is the hypertension. So if you have to plan this study, how will you plan? In this case, so you have started with the migraine cases, all migraine cases, and then you followed them up for a period of 9 months, maybe till the time that hypertension occurs. And you have this hypertension in pregnancy present and absent. So all of you type in the chat box which type of study design this is. I'm waiting for your responses. Okay. Okay, so now you have understood. So one person has written cross-sectional. But I've said that I will calculate the absolute risk, and I've started with migraine and then followed them up. So it cannot be a cross-sectional. And again, this, if I have this also, like I have taken 2 group, migraine present and migraine absent, and then I followed them up to see. So it is a classical cohort, whatever name you want to give, that is. So now I think you have got this point. If what will be the study design? If I have taken all the women of migraine and I have only seen the hypertension, I have only taken only those ladies who are hypertensive. So yes. And this one, so as a case series. So yes, so all of you now know, and I'm happy to see your responses that you have understood this well. So now there is another title you can see, that is the delivery by cesarean section and risk of obesity in the preschool children. So in this case, what is the exposure and what is the outcome? First define that. So yes, exposure is cesarean section, and what is the outcome? So outcome is it is very obvious, it is the obesity in the preschool children. So that person has done this as a form of a prospective cohort, but can this study be done as a retrospective cohort study? Please write yes or no. Can this study be done? So few people, it's a mixed responses, but majority of them, you agree that it can be done as a retrospective cohort. Well, how it can be done? Like you can go and you can take all those in a hospital, you can go and take all those ladies who were delivered through cesarean section, and then you can go to them and see their preschool, like less than 5-year children, and you can measure the like BMI and the other anthropometric measurement, and you can decide whether they are obese or not. So in this case, already the event has happened, but you are taking that from the record. And Diksha is writing, we can take the birth weight and childhood obesity. Yes, you can do that also. You can take the birth weight and childhood obesity also. And okay, so you hospital recording, taking the C-section female and see the childhood obesity. Yes. So it can be done as a, we can take the birth weight, childhood obesity. Yes, that can also be done. So now you know, whenever you start from the exposure and then you measure the outcome. Outcome is always measured later. You recruit the individual on the basis of outcome. So that is the difference between a cohort and a case control study. So this is slide just in the midway. So you will get all these content on the website, that is the www.meritindia.org. And this is under the Common Creative License. We do believe in the Common Creative License that you can use all the content freely wherever you want to disseminate. And we just want the dissemination of the content. So everyone should know. So there is no bar, like you cannot use the slides or you cannot use the PowerPoint. Everything is available there, and you can use in your workplace, in your teaching, wherever you are teaching or you are mentoring or whatever exercise you are doing, you can use that. So now let's do some calculations and we will do some hands-on. So again, like the previous sessions, I will show you with one example and then you will calculate it on the other example. So I hope all of you, please open that statulator or maybe the calculator, because today we will do few calculations. I think one calculation over the calculator also. So now there are few steps. We have done this step in the cross-sectional and in the case control. Again, repeating the same thing. What are the steps in the sample size calculation? So the first step is you identify a research question, and then you define your study variables. What that study variable is, whether you are taking it as a form of a mean or you are taking it as a form of a proportion. So you can have that research question and study variable. Then you have to do a thorough literature review, because in that literature review only you will be able to know regarding your study variable. Then you have to set the parameters for sample size calculation. Then you calculate the sample size. You do some adjustment depending on your need. Like you may increase or decrease the power, you may increase or decrease the precision, or you may take the non-response, or you may take other adjustment depending on other adjustment like dropout or maybe clustering. We have seen all those concepts, how we do adjustment, and then we do the write-up of that sample size calculation. So now there are a few considerations in cohort study, and we'll see the various example of cohort study through which we can calculate the sample size. So the first type is if we want to do a hypothesis testing for a relative risk. So we know that relative risk is the most common measure which we do for if you have got a comparison group. Definitely you can recall that session on when we can calculate the relative risk and when we cannot. So in this case, if you have a comparison group, you can calculate a relative risk. And if you want to do a hypothesis testing of a relative risk, how will you do? So what are the inputs which are needed if you want to do a hypothesis testing in case of a cohort study? So the first one is you should have a anticipated proportion of outcome in the exposed group. So exposed group, since we have got two groups, so imagine that there is an exposure group and there is a non-exposure group, and you have to see the outcome in both the groups. So what is the anticipated proportion of outcome in the exposed group? What is the anticipated proportion of outcome in the non-exposed group? And that anticipated relative risk, because you anticipate also what will be the relative risk in case of a exposed person. So out of these three, you should have at least two values with you, then only you can calculate the sample size. The other three things you can decide at the level of significance. So we have learned that we usually keep this level of significance as 5%. Then power of the study, we know now what is the power of study. 1 minus beta is the power of study, and beta is basically accepting the null hypothesis when it is true. So this tells you regarding that how much sure you are, how much confidence you are that the study will detect that much difference. And then regarding the one-way and two-way, one-sided or two-sided hypothesis. So we have talked regarding all these basic concepts in the first session of the sample size calculation that was on the cross-sectional study. So generally we keep 5% level of significance. We keep power as 80%, but it may range from 80 to 90%. And then you can have one-way or two-way alternate hypothesis. So if your if you reduce the level of significance, your sample size increases. If you increase the power, it has got a direct relationship with the sample size, so your sample size increases. And you can do that in the statulator by changing the values of power, and you can see how the sample size is behaving. And then depending on the one-way or two-way hypothesis, if the hypothesis is two-way, the sample size is slightly more than the one-way hypothesis. Many times you have to give the formula in your thesis while you are sending your manuscript for publication in any proposal. So for that, we have given the sample size formula here. We'll again revise the sample size formula, because if we were referring to the Kirkwood textbook of sample size calculation and epidemiology by Betty Kirkwood, and he has simplified these formulas So we'll try to have those formula together at one places, and it will be there in the website, that meritindia.org also. So you can take those formulas from there also. So that is there. And we are in a planning of developing our own calculator, because right now you have to take help of more than one calculator. Like there are few calculations which you cannot do on statulator. We'll see what is the limitation of statulator. So we are planning to have our own calculator. We are in the process of developing that. And then in all one places, at one place integrated, there will be an integrated calculator, and using this formula, because this formula is only for the writing purpose. Otherwise, we are not going to use this formula in the calculation part. So using that calculator, you can calculate that, and then you can give this reference of the formula in your write-up. So this is again Z1 minus alpha. We know that is the desired level of statistical significance. At that 5% level of alpha is 1.96. And this Z1 minus beta, we take it as a power, desired power, which is typically 0.84 at the 80% of power. And then this P is the average proportion. So P1 plus P2 by 2 is the average proportion. We have seen this in the sample size calculation for case control also, case control study design. And this is the proportion of the outcome in the exposed. And this is the proportion of outcome in the non-exposed. So this is the formula you can write. Yes, you will get the recording of this session. All the recordings, I hope you must have gotten the previous 2 recordings also. So you will get it. And then we will, now we'll see this example. So you have, we have planned to evaluate the recurrence rate of a particular cancer in the first 5 years. And there are 2 therapies. So there is a therapy A and there is a therapy B. So the recurrence rate, it was observed in 35% of the patients on treatment B, and you anticipated that treatment A halves the risk of recurrence in the first 5 years of treatment. So you want to prove your hypothesis with 90% of power and 5% of the level of significance. So although this example seems to be an example of the randomized control trial, because you have started with the therapy, but still if you can take this, this is not a observational study, because cohort study is an observational study where you don't plan any intervention. But just to show you one example of this relative risk. So in this case, recurrence rate in the treatment B is 35% and treatment A, you know that the relative risk is 0.5 in the first 5 years. So now how you calculate the sample size? So this is the input. So based on your review of literature, always try to have these figures written with you at one place. Then only you will be able to put that in the calculator. So right now, if I see, I have the proportion of outcome, that is the 35%. And the anticipated relative risk, because I am thinking that group A will have less recurrence. So the relative risk is 0.5 and the level of significance is 5%, power of study is 95%. So let's do, let's calculate it. So we'll go to the statulator. So this was the interface, just to revise all of you who could not attend the first and second session. So this was, you can see if you use this drop down menu, there is a classification of proportion and there is a mean. So this proportion is for the estimate, if you want to estimate a single proportion, if you want to compare 2 independent proportion, or if you want to compare a paired proportion. So this paired proportion we use in case of a paired sample t-test. And then this mean is for the estimation of a mean. And then you compare these, if you have 2 independent means, you can compare, you can calculate the sample size by comparing the 2 independent means also. And then you can have this compare paired differences also. So this is the interface. So in my case, the relative risk was 0.5. And in the reference group, I know that it was a 35%. So you can go here, so this was the expected proportion. You can see this formula. I'll go here, I'll click this and I'll use 2 independent proportion. So if I click this, so expected proportion in the reference group is 0.35%. So I have made it like 0.35. And then the other thing is the measure of association. So measure of association is the relative risk. And relative risk was 0.5 in this case. So I have typed 0.5. And then you have to use the 90% of power. So I will press this change because I have to do the adjustment, or I will drag this to 0.9. So now it is 0.9. And this level of significance was 5%. So I will not change it. Alternate hypothesis was two-sided and group sizes were equal. So I'll just update this and I'll calculate this. So it is 107. And after you press this calculate, do read this explanation. It will tell you, because many times that 80% is again, I have done that 80%, but again it is coming as 90%. So I'll again make it as 90 and then update this. So now you can see that it is 139. So 90% power and 0.5% of relative risk and this alpha value of 0.5. So you can see, this is the way you can write your write-up. You can just replace this like subject in the reference population. So you can write here the content which is there for you, like in this case. So you can write the proportion of recurrence in the treatment group was 35%, and then anticipated relative risk was 0.5. So then this will be, so your estimated sample size is 139 in each group. So the total sample size is 278. So do see here that your total sample size is 278. So now coming to the next example. So now it is your turn to do the calculation. Just see this. You plan to assess the fetal loss attributed to the second trimester amniocentesis. Okay. So the second trimester amniocentesis is a exposure and the fetal loss is the outcome. So the risk of fetal loss in normal pregnancy is 1%. And you are hypothesizing that the risk is 1% high in amniocentesis group, and you want to prove this hypothesis with 90% of power and 5% of the significance level. So what is the sample size needed to prove this hypothesis? So again, you can see this, the alternate hypothesis is one-sided because I assume that the loss will be there with the amniocentesis group. So the proportion of fetal loss in normal pregnancy is 1%. Anticipated risk difference in the amniocentesis group is 1%. That means you have to use 2%. And then level of significance is 5 and power of study is 90%. So all of you please calculate this and text in the chat box. What was the calculated sample size? So you can go to the statulator.com. While you are doing it, I will also do. So what should I, because for the people who cannot do now, so you can see here, so I have to use 2 proportion. So this is the 2 proportion. So I have to use the outcome proportion in the reference group. So it was 0.01. So I'll just put it 0.01. And since it was 1% higher, so it will be 0.02. So it is 0.02. And then you can calculate and then you can because it was 90% power, so you can increase the power to 90%. And the alternate hypothesis was one-sided, so I may do this one-sided, and then I'll update this. So you can go through the write-up that the required sample size is 2,723. And you can see here that 1% of the study subject in the reference population have the factor of interest, and the other one was the 2%. So there was a difference of 1%. That was a difference of proportion of 0.01%. And then it was a one-sided hypothesis. So this total sample size is the 5446. So this was regarding the, so I don't know how much you people got. May I have at the, what they have written? Could anybody calculate this? OpenAP also you can go and enter the same, yes. So what was your value? So 2723. So depending on that, you can see the most important is to identify the input values. Whether you do a OpenAP, whether you use a Statulator or you use maybe SPSS calculator, and there are many other calculators also which are available. So you can use those calculator. There might be slight difference between the sample size, like ranging from 10 to 30. But that is depending on that all those background, hypotheses which they have tested. Like many people do the continuity correction and that T distribution, Z distribution. So depending on that, there might be difference of few numbers if you use the more than one type of calculator. You can cross check that. Okay. Otherwise, more or less, it will be very nearly very same. So this was regarding the hypothesis testing for a relative risk. Now, if you have to estimate the sample size for an incidence rate, so right now we don't have a calculator for that. So we'll do it, we'll use a formula and we'll see how to calculate if you want, if you have the, if you want to calculate the incident rate. So you need only confidence level and relative precision. So that confidence, the formula, it is the Cochrane formula. It is the modification of Cochrane formula only, where you assume that to be as a 50%, that single precision, single proportion. So this Z1 minus alpha, that is at 1.96 divided by the, and in this case, we take relative precision. Please be careful that we don't take absolute precision in this case, and we take relative precision. So we take the confidence level and we take the relative precision. So this represents the desired level of statistical significance, which is 1.96 at the 5% alpha. And then this is the relative precision. So the example is investigator wishes to estimate the rate of dropout from a rehabilitation program in post-stroke survival case. An investigator wants to estimate this rate within 10% of its true value. So that rate is the incident rate, but the outcome is the dropout. So he wants to see the dropout rate, and that rate he wants to see it within 10% of the true value with a 95% of confidence level. So what will be the relative precision in this case? So the relative precision will be 10% and confidence level will be 95%. So the formula, you can use this, this table also. This table, we have taken this from this Lavanga and Lamshow, which is a very good it's a document for calculation of sample size given by WHO. And in this case, you can see here that at the level of 10% relative precision and 95% interval, the calculated sample size is 385. So you can see here. And that is also one way, like you can give sample size on 3-4 relative precision or 3-4 levels of confidence. And then you can write that no, feasible sample size for you is this much only. and that's why you took this much sample size. Because I will just share one example of thesis at our institute. So many PG students, they got review. After review, they got this feedback from the thesis reviewing committee or the people that, why they took that small sample size. Because of that, they cannot generalize the result, or that external generalizability of that result will be poor. So in that case, the best way is to show the sample size with more than one precision. So you can make a table, and you can show that these sample size at the level of 5%, 10%, 20% precision. And then again, you can show them the sample size at the level of various power, 80%, 85%, 90%. And then you can take a value and you can write in your thesis or in your proposal that in a given period of time, like in 1.5 years or 2 years, you can only take that much of subject. So that is the limitation of maybe your thesis. If the time permits, you can extend your research work. So for thesis work, we do recommend you please write in as a separate note that, because of the lack of time, you could take only this much. So that is the limitation of your study. Okay, so now with this, if you can use this also, or you can use the statulator also, because statulator, if you take that relative precision in 50%, so I'll show you with statulator also with this 10%. So because it takes the exposure at 50%. So if I use this single proportion, and if I this 95% level of confidence, and this absolute margin you have to take as the this relative, and here I will take it as a 0.1 because it is 1%. So if you calculate this, you will see that it is 385. Because this is the modification of Cochrane formula only. In the Cochrane formula, you take the expected proportion as 50%, and if you take the relative precision as a measure of absolute, that P, then obviously this is the same formula. So this is the calculation for a incidence rate. If you wish to calculate the incidence rate and hypothesis testing for incidence rate, then you can use this. So now it is, now you will use this to calculate this example. See, so an investigator, so this is for you people, please calculate and type in the text box. An investigator wishes to estimate the risk of miscarriage with caffeine consumption during pregnancy, and he wants to see this rate, that whether it is 8% of its true value within 95% confidence interval. Okay, so this is again exposure in this case. What is the exposure? All of you please write. The most important for you is to identify what is the exposure and what is outcome. So what is exposure in this case? Caffeine, yes, an outcome. What is the outcome? Miscarriage. And this 8% is the relative precision. Okay, so this is the value, 95% and 8%. So what is the answer? 601. Okay, let me check this for those who could not do it. So I will just, what I'll do here, 8% I'll do it 0.08. The rest of the things will be same. So yes, it is 601. So all of you are right. So you have done it correctly. So we calculated the sample size for a hypothesis testing for relative risk, where we have seen that we needed at least 2 of the input value, which was the outcome in the proportion of outcome in the exposed or non-exposed group, and the relative risk. That we saw with one example. Then we did the incident rate calculation. So if you want to hypothesize regarding the incident rate regarding using the relative precision, then we have seen this example. And now coming to the third example type of calculation of sample size. So third is the hypothesis test for 2 incident rate. So in case if you want to do the hypothesis testing for 2 incident rate, in that case, you have to decide, you have to choose the formula of 2 incident. And before that, we have calculated that incident rate. Just to revise you, that we calculate this incident rate based on the person year. So this, in the numerator, we take the number of outcome. We have seen this before also. And in denominator, we take the person year. So the input needed in this case will be the anticipated incident rate in the exposed group, anticipated incident rate in the non-exposed group, and the other 3 things which we need is the level of significance, power of the study, and the alternative hypothesis, whether it is one-sided or the two-sided. So this is the formula for the, if you want to do hypothesis testing for an incident rate. So the formula of this is the U plus V square, mu1 plus mu0. We will see what is this mu. So this U is again that Z1 minus alpha. So this we have taken it from the Kirkwood, and they have simplified this Z1 minus alpha and 1 minus beta in the form of U and V. So this U is represents the desired power, which is 0.84 80%, and this V is represents the desired statistical significance at 5% level. It is 1.96. So that this 1.96 plus this 84, you can have the two this thing together, and then the third thing is your mu1 plus mu2. So this mu1 is the incidence of outcome in the exposed, and mu0 is the incidence of outcome in the non-exposed. And in the denominator, you take the difference and then square it. So that that is how you calculate the hypothesis. You do the hypothesis testing for the incident rate. This formula is not there with the statulator. So for this, we will have to calculate it manually. So we'll see it how to do it. So we'll do what we can do. You can see this is the example. So as a part of study of long-term effect of noise on worker in a, so just listen to this example very carefully. So an investigator want to study the effect of noise in the on the worker, and he want to see whether this exposure, he took it as a noise, and he took another control group which was working in a quieter industry. So this is again example of external comparison group, whether the person took another industry person as a less exposure. And then annual incidence rate for hearing impairment. He is taking exposure as a noise and outcome as a hearing impairment. So he's assuming that the hearing impairment in quieter industry is 10%. And incident rate of hearing impairment in noisy industry is 25%. So if you have to, now you know these are the two figures. So if you assume that the incident rate of hearing impairment is more in noisy industry, that means it is a one-way hypothesis, and you wish to test it with 80% of power and 5% of significance level. So which formula we will apply? We'll use this formula. So in this case, the 1.96 and 0.84, what will be the total value of that? So let's see it on the calculator. So I'll go here and just I'll write it these two values. So this 10% and 25%. This is the percentages. So you have to go to the calculator. So I think let me open it. Simple calculator. I'm using that simple calculator. So this 1.96 plus 0.84. This was 2.8. So this we will take as a U plus V square, that multiplied by 2.8. You can use this X square also. So this is 7.84. And then if you take the incident rate, so it was 10% and 25%. So it will be 35. So in the numerator, if you see, it was 35. If I see again, so it was 25 and 35. So 35 will be in the numerator. So 7.84 multiplied by 35. 7.84 multiplied by rate if we take 0.35. And this was 0.96, and this we have to divide. So I am writing this number 0.96 and divided by, it was minus and square. If you again see, so the formula was this minus this. So right now the difference will be 25. So 0.25 square will be 0.0625. So it will be this number divided by 0.0625. So it will be 15 in each group. So this is how we can calculate. So this formula, if you want to compare the incident rate, you have to do it manually. That we have shown you how to do it in the two proportion, in the two incident rate. So now if we, now the fourth example, estimating the relative risk with the relative precision. So in this case, you need the proportion of outcome in the exposed group. This is the proportion of outcome in the non-exposed group. What is the anticipated relative risk? What was the confidence level and the relative precision? So this was the formula. Again, this is in the form of Z1 minus alpha, and P1 and P2, this relative risk is P1 by P2. So this represents the desired level of significance, and then this is the relative precision. This is the formula which we have applied is the relative precision, and this is the relative risk. So if you have to calculate, just let's see the example, how we can calculate. So this is, you plan to study a pregnant woman suffering from migraine. They have a higher risk of hypertension than the normal women. So hypertension is seen in 10% of normal pregnancy, and you anticipate that the relative risk of hypertension is 2 times higher in the women suffering from migraine. And you want to estimate this with 50% of the true value. So you want to estimate this as a 50% of the true value, and you know that the hypertension is seen in the 10% of the normal pregnancy. So that is the background, or the comparison group of the normal pregnancy is 10%, and the relative risk is 2 in case of suffering from migraine. And this relative precision is 50%. So this, if you take the measurement and if you take the input, what input you should enter, that is the proportion of hypertension in normal pregnancy is 10%, the relative risk is 2, confidence level is 95%, and the relative precision is 50%. So for this, Statulator doesn't have this option of calculation of the sample size based on the relative precision of that relative risk. So this is the formula, this is the link which we have given you in the text box, and you can use that just to see, because you have to calculate also. So press this link and then it will lead to, so this is the, so this alpha will be, in this case will be, this alpha is the 0.95, the 5%. So it will be 0.05. This P2 is the proportion, which is the 10%. So it will be 0.01. You have to write it in the decimal. And this relative risk was 2. So this relative risk is 2. And the precision, so this relative precision is 50%. So you have to write 0.50 and then calculate. So sorry, I think relative, this percentage you have to write like 50. So in case of, So it was 10%. By mistake, I wrote 0.01. So now if you calculate, sorry, by mistake, it will be 0.5. So if I calculate this, this will be 104 in each group. So this is the total sample size, or in case you want to estimate the precision based on the relative risk. So now it's your time to do the practice. So now you do this. Yes, I'm sorry for that confusion. By mistake, I was entering 0.01 because it was 10%, so it will be 0.1. Similarly, that 50% relative precision will be 0.5. So I was entering by mistake 10. That's why sample size was coming that high. So I'm sorry for that. Yes, you have corrected me, and I also realized my mistake. So it was 0.1 and 0.5. So now this is we have pasted that link in the chat box. You can use that link and you can do the calculation of the sample size. So in this case, the exposure was vitamin D. So all those people who received vitamin D, you have followed them up for the development of the oxygen requirement. So the vitamin D was the exposure and the outcome was the oxygen requirement. And you assume that the 60% of the older patients, they required oxygen therapy, and you anticipated that the relative risk in older patients will be, whom you prescribe vitamin D will be 0.5. So you want to estimate whether this will be 20% of the true value or not. So that this 20% will be your relative precision, and this proportion of elderly with COVID-19 who need oxygen therapy is 60%. And the anticipated relative risk of oxygen therapy taking vitamin D would be 0.5. So please calculate this using the calculator which we have shown. So if I also do this, so it will be 0.2, 0.6. So P2 here will be 0.6 and relative precision was 0.2. So it will be 39 in each group. So the total sample size will be 78. Oh yes, I'm sorry. It will be 0.5. So now we'll go to the next example. So we have got few more examples. So this is one study where the author, he has seen the decreased antibody response. Oh yes, thank you, Varun. I realized my mistake. By mistake, I did not change the existing relative risk. So you are right, it was 0.5. So that's why my calculation was not coming, right? Thank you so much. So decreased antibody response to influenza vaccination in kidney transplant patient. It was a prospective cohort study. And in this case, what the author did, you can see here that he has justified the sample size. So he calculated the sample size using the, he took the 20% difference in the sero response and sero protection between the two groups to be clinically significant. And then he has used the power of 80%, and he has used this, if you see this, he has used 2:1. So although he has written controls and cases, but ideally it should have a comparison group. We should not write this control and cases because classically that we use for the this case control study. So there was another article. You can go through this article and you can calculate that sample size. And then maternal anemia and birth weight. Again, the exposure will be the maternal anemia and the birth weight will be like the baby birth weight. So again, the author, if you see this, so it is the same. Okay, so that also you can do that. I think we have pasted some wrong information over that. So we will share that article on our website. You can go through those articles. And this presentation also will be shared in the form of this recorded session, as well as you will get it as a form of presentation also. So I hope this session was useful for all of you, and many people are asking for certificates. I can see in the chat book. So I think Venkatesh and the Clearnet team may respond to this question. And the next webinar is on sample size calculation for randomized control trial, which will be held on 12th April. Maybe we will try to split this sample size on RCT into two parts, because it is a quite extensive, because there are many types of trials like superiority, inferiority, equivalence, equality. So based on those concepts of trials, we may split these RCT session into two parts. So then I think stay connected with us.
Thank you, ma'am. Thanks a lot for the wonderful session. Hope all our participants would have benefited largely from this session. Now we have come to the end of the session. Once again, I extend my sincere gratitude to Dr. Pragya ma'am, Dr. Samshad sir, and all our 1,200 plus registered participants for making this webinar a grand success. E-certificates for this session will be mailed to you within a week's time. There is no need for filling any feedback form. E-certificate will be sent to all the attended participants. I would also like to welcome you for our next webinar on sample size calculation for randomized control trial, which is scheduled on April 12th. Probably we'll have it for superiority trial. We will also share the registration links for those shortly. If you are interested to know more about our future sessions, you can always check out our department Facebook page, Department of Community and Family Medicine, AIIMS Patna. You can also visit us at www.meritindia.org. Hope to see you in the next session. Thank you. We are closing now.